May 2019, KECHEMA was created and saddled with the responsibility of implementing the Kebbi State Contributory Health Scheme.
Less than 5% of Nigerians registered into the National Health Insurance Scheme as of 2015, barely 10 years after its creation in 2005. This necessitates decentralization of the scheme through the creation of state healthcare insurance schemes. In Kebbi State Contributory Healthcare Management Agency KECHEMA came into being after the passage and assent of the bill establishing the agency in 2018. Saddled with the responsibility of implementing the state contributory healthcare scheme, KECHEMA has changed the status of over 100 healthcare facilities from a mere drug descriptive facilities to an all-inclusive healthcare providing facilities in just 2 years.
4,284.
These facilities were subjected to rigorous selection process in accordance to the laid-down rules of the National Health Insurance Authority and National Primary Healthcare Development Agency.
Saboda talaka suna jin daɗin wannan ƙungiya ta KECHEMA.
Refers to as a hope for the hopeless, KECHEMA provides quality healthcare service delivery to over 300,000 clients across the 21 local government areas of the state within the 2 years operational period. Today, KECHEMA lifted the number of hospital attendants and facility delivery rates to 32% from 8%. To ensure their client receives quality healthcare service delivery in conformity with the standard. Apart from the routine inspection by the Quality Assurance Department, KECHEMA sponsor an annual media tour to these facilities to disseminate accurate information about the scheme. The media tour was taken to selected facilities across the 18 of 21 local government areas of Kebbi State.
By May 2019, the agency was created and saddled with the responsibility of implementing the 4 programs actually. We have the informal sector program, we have the formal sector program, and we have the equity plan, and then the 4th one is the private contributory scheme, which we are yet to operationalize.
KECHEMA provide all the available services provided at the primary healthcare centers, secondary healthcare centers, and even some services at the tertiary institutions.
There are partial exemptions like dialysis, for instance, MRI, CT scan. These are partial exemptions, meaning we pay 50% and the enrollee pays 50%.
Its referral services are given to all clients receiving treatment at primary healthcare centers, to secondary healthcare centers, up to tertiary healthcare facilities. We got one man who had a problem with his leg. He came to this facility and I observed that his problem is beyond my capacity. I then sent a referral code first. When I sent him, they treated him well.
I came
to the facility almost 2 times for the problem I have with my leg. When the IC discovered that my problem is beyond his capacity, he then referred me to General Hospital Kamba. I went there. I am now receiving treatment. Because when I was battling with my leg, I cannot walk nor stand without a stick, to the level that I cannot even stand up. I then come to this facility. They tried their best, but later referred me to Kebbi Federal Medical Center. There, they gave me medicine for 30 days, 2 times. Thank God, because I can now walk. a distance of 5 to 10 kilometers.
More than 10,000 pregnant women delivered free of charge at the facilities. Because of the program, the facility delivery rate, skilled birth attendance in our own enrollees has jumped from the 8% that we know Kebbi of to 32% now.
Fatima Sani was one of those over 10,000 benefiting pregnant women.
You see, I undergo CS and I am happy I am now recovering. Did not pay a CC.
Zayan Bashar Zaga is the IC Primary Healthcare Center Zaga. Said the diseases frequently treated in the facility are malaria,
breast lumps, delivery complications.
She is a KECHEMA's enrollee at PHC Zaga. Aisha Farouk, who was referred to Federal Medical Center Kebbi, said,
I have been coming to the facility since when I was pregnant to my D-Day when I came for delivery. I experienced a complication after delivery leading to bleeding. They referred me to Kebbi.
Facilet Salihu Primary Healthcare Facility, Dole Kaina, explained the processes of examining KECHEMA's client in the facility.
When they came, we collected their card. We direct them to IC office for examinations. After that, we send them to pharmacy. We admit those with serious sickness while we administer drug to outpatients.
A patient of Nigeria-Niger border PHC Dole Kaina, Aisha Yahaya, undergoes through the processes before she was administered drugs.
I came with malaria typhoid. I also have hypertension when they tested me. They often asked if I have been taking drugs. When I say no, they advised me and I enjoyed it. Honestly, they took care of me because they tested me before giving me drugs.
At PHC Zamari of Yawuri local government area, we met an old man who was graced by the helping hands of the federal government's Basic Healthcare Provision Funds program. Malam Said Wapashi Gajere said KECHEMA provided to him all the needed medicine free. I collected drugs here. When I finished it, I came for the second time and they gave me, which I'm still using. I did not pay a kobo.
If you go around and see the facilities that deal with KECHEMA and compare them with those that are not dealing with KECHEMA, the difference is clear. Even in terms of human resource, in terms of availability of commodities at the facilities, and so on.
We have some development. Last year we were able to build a plot of land. Now we build 5 rooms. We build labor room. We build family planning unit and pharmacy. Workers, we have 6 auxiliary staff. You see, we are developing.
We only do RDT test because it's the only pre-test kits given to us. But now, since the coming of KECHEMA, we do HIV test, HBsG, Widal, HBC, genotype, and the rest.
Frankly, we achieved a lot. With KECHEMA's capitation, we employed ad hoc staff. There are also some renovation of GOPD, family planning. We provide a gardener in the facility. There are also some constructions we built, watchman room, and we fenced the whole facility.
The program is beneficial, looking to the fact that there are poor people who could not feed their family, not to talk of settling their medical bills. Therefore, all those enrollees should come to the facility when they are sick.
The WDCs now, the World Development Committees, are now back to life. These committees were established so that we will have more community participation in what the facilities are doing. But you know, it was like a non-entity before money from KECHEMA started to go to the facilities.
In our facility, KECHEMA's enrollees are taken good care of. If it calls for his referral, he would be referred. There was one man who was referred. He almost spent a year receiving treatment. The man could not afford his bill, but because of KECHEMA, he is now fully recovered.
Besides that, KECHEMA has been collaborating with different professional associations and organizations in conducting outreach programs.
We organized this pre-medical outreach in collaboration with KECHEMA.
There was an outreach program here in Godangwaji. There was an outreach program at Mato in the local government, an outreach program in Zoo.
KECHEMA is the only contributory scheme in Nigeria that charges less than 5,000 naira per life to access the unlimited healthcare services for a period of 12 months.
I prayed Allah to give more strength to continue helping the poor. Frankly, the program is beneficial. May Allah help those behind this program.
Beneficiaries' testimony shows how KECHEMA's leadership set it on the right path. During the media tour to the Lani Primary Healthcare Facility, the media team made a stopover at the palace of the district head of Lani. What is expected of KECHEMA is to start operation, to expand, and for people to benefit. And it is exactly what is going on.
That is what necessitated the creation of KECHEMA. It was the bid of the federal government to achieve universal health coverage, which is a target number 8 of SDG Goals 3, and to achieve it with the participation of the subnational entities, the states.